Uganda was selected among 12 African countries to receive 18 million doses of the first ever malaria vaccine as a critical step forward in fighting one of the leading causes of death on the continent. The first allocation will run from 2023 to 2025, where Uganda will receive 1,750,000 doses of the vaccine, according to Dr. Daniel Chabayinze, the Director in charge of Public Health at the Ministry of Health.
In the whole world, the number of vaccines to be produced are limited. We want to give people 4 doses. So that means if we receive 1 million doses or 800,000 doses, we will be able to only vaccinate 250,000 children. So we are going to target, because the initial allocation framework from WHO shows that we can only access limited vaccines. So we've made a schedule where we shall first go to the places which have high malaria cases, and that is northern Uganda and eastern Uganda primarily now, or where other interventions have not penetrated exactly to the last child in every community. We need to be as equitable as possible.
Malaria kills about 18 people every day across the country. According to the World Health Organization, the vaccine has shown to be safe and effective in reducing severe malaria and deaths. Since 2019, Ghana, Kenya and Malawi have been delivering the vaccine through the Malaria Vaccine Implementation Program, resulting in the vaccination of more than 1.7 million children in the Phase 3 trial.
We shall start most likely at 9 months. And if not 9 months, we shall be like what Ghana did. They started at 12 months, when we do expect to have other vaccines. So we want to give these within the routine setting, like when we know children are coming for other vaccines, that's when we shall give them. We had only one vaccine approved. WHO added another vaccine. So R21 is another vaccine which has been approved, and for it the manufacturing capacity and availability has a larger volume which can be accessed. So Uganda is in transition, whereas we received approval and planned for the first vaccine. We are now also going to ask for the second vaccine, so that we can increase the number of people who can access this.
We chose the R21, which is a cheaper vaccine. Before then, the vaccine was from Glaxo and it was extremely expensive. The vaccine is only given to children. It is not for adults. It reduces severe malaria. It also reduces hospitalization. And we are very hopeful that it will put a dent on the burden of malaria. The Ministry of Health is aware that some members of the private sector have already brought in the malaria vaccine. The type that has been brought in is the Glaxo type, that is a branded vaccine, and they started using it. Yes, it is good, it is safe, it is effective. But for those who can wait, what government is bringing in will be free of charge, because it has already been paid for by the government of Uganda and by Gavi. And moving forwards, the malaria vaccine will be distributed free of charge to all who need it.
The vaccine will work alongside other interventions like indoor residue spraying and the use of mosquito nets. Dr. Chabayinze explains some of the expected effects of the jab.
Of course, with anything injectable, there can be side effects or effects in when you are injecting. Some people can get pain at the site of injection, and everything taking root into the body can give a small fever.
Uganda is among the top 10 malaria-burdened countries in the world, contributing 5% of all cases globally. Walter Mwesigye, NTV.